Let's talk sealants, dental sealants, Dr. LeBlanc.
Okay.
Do adults have them? Only young people have them? What's the benefits? How long do they hold?
Yeah, thanks for talking about sealants, because they let me discuss one of my favorite things to help people, which is the discussion of decay. So whenever someone asks me about sealants or I recommend sealants, I always start with the decay discussion, because it amazes me that neurosurgeons and some of the smartest people I ever run into, I ask them what is decay, and they give me the funniest answers. They just don't know. So what is decay, Helmut? We have the bacteria.
It's a wrinkle in your face.
Helmut, what is decay? I want to ask you before I tell anyone else.
It's a wrinkle in the face, of course. That's
I love it, a wrinkle in the face. I love it. Well, aside from the wrinkle in the face, the decay is actually a process. We have the bacteria in our mouths. We all have it. The bacteria eat the carbs and the sugars we eat, and the bacteria then secrete acid. So to make it simpler than that, the bugs eat the sugar and spit out acid. The acid, most people know what acid does. It eats things up. It demineralizes the enamel on our teeth. Then we're left with a hole. Well, someone came up with a fancy word for a hole, and that's a cavity. A cavity, if you look it up in the dictionary, is a hole. So that's the decay process. So understanding that, any nook or cranny that's on a tooth surface is going to harbor the bacteria. The bacteria are going to do what they do, and you're left with a hole, which is what the decay process brings. So now back to sealants. On the biting surfaces of the teeth, and why do teenagers and the adolescents get more sealants? Because we're able to catch it at an earlier stage. By the time they're 20 or 30, the bugs have already caused a decay processed hole in the surface of the tooth. So on the biting surface, if it's groovy, if you will, if it has a lot of grooves in it, it's imperative, if you don't want decay to ensue, to seal that surface. So then what is a sealant? A sealant is real simple. It's a type of bonding. Bonding is resin-based. So we prepare the tooth with a phosphoric acid solution, painless. Then we put in a sealant that bonds to the tooth. It's a resin-based sealer. Well, now it's as smooth as silk. There's no groove there anymore. There's no place for the bacteria to hide. There's no place for them to grab onto. So they have no place to do what they do, which is cause a cavity.
Okay. How long does such a sealant last, more or less?
A sealant can last decades. A sealant that's done properly can last for decades.
Okay. And it's mainly needed in the back teeth where there's a big surface going on, the chewing.
Correct. And it has more to do with the surface of the tooth. The way the back teeth they have grooves on the top, probably for a roughness to chew better. If you feel the front of your front tooth, it's a very smooth surface. But if you feel the surface of the teeth we chew on, our back teeth, they're rough. Now, we don't seal them up so that you can't chew anymore. We're just sealing up the more microscopic grooves in the surface of the tooth where the bacteria harbor and cause the decay.
Because you can't go in there with a brush or a floss. You're just not going to get it out.
There's a great picture, Helmut. I'm glad you brought up the brush. There's a great picture. It's a microscopy picture that we have here in the office that shows a tooth that's cut in half, and then they take a picture of the groove, and right over the groove they have this big rod, something that looks like a big rod, when in reality that big thing that looks like a rod is a single bristle of a toothbrush. The bristle of the toothbrush is quite a bit larger than the groove. So what is that showing? You cannot clean in the grooves. You just can't. So
you might even stuff it in.
No, the bacteria don't need to be stuffed. Bacteria find their way in.
Right.
So yeah.
Okay. So you suggest, like, as soon as or almost as soon as the second teeth erupt, one should try to attempt that. And then
yes, and immediately. You can, if patients say, I recommend sealants, and of course most patients just go with what we recommend because especially with a sealant, the public knows about sealants now. It's not an unknown commodity. They don't say, what, a sealant? What are you trying to pull on me this time? They know that they have those big silver fillings on the top of their teeth, and that if they would have gotten preventive sealants, they never would have gotten those silver fillings, which then lead to a bigger filling or a crown or something like that. So any tooth that has deep grooves, or any tooth with any grooves, a sealant is just absolutely the way to go. There's no reason not to do it.
All right. It's prevention. So we really,
absolutely.
Technology of prevention did advance. It's there. We just need to avail ourselves of it.
Absolutely, Helmut.
Thank you very much, Dr. LeBlanc.
All right. Thank you.